My name is Dr. Silvia Situma. I'm a PhD fellow at the University of Nairobi and Washington State University. I work on Rift Valley fever disease, looking at the maintenance and transmission of the disease during interepidemic periods. Rift Valley fever itself is a disease that is mosquito-borne, and it primarily affects livestock, and it has a significant threat to human health. It was first identified in 1931, and since then it has caused recurring outbreaks in East Africa. And today the threat is growing because climate change is amplifying the frequency and expanding the geographic reach of outbreaks. Traditionally confined to arid lowlands, RVF is now spreading to highland, areas once thought to be safe. The shift in the landscape is driven by changing rainfall and rising temperatures, which underscore the urgency to act. To understand these evolving threats, our research mapped RVF outbreaks across East Africa from 2008 to 2022 using data from Ministries of Health and Agriculture and online databases. We analyzed 100 RVF events considering factors like rainfall, temperature, vegetation cover, and land use changes. We discovered alarming trends. Rising temperatures and shifting rainfall patterns are driving RVF into new highland areas. A 1-degree rise in temperature or a slight increase in vegetation cover just 1 month prior to the outbreaks were linked to higher RVF incidence rates. Highlands that once experienced mild weather are now hotspots, with 76% of RVF clusters in Uganda and 43% in Kenya occurring in this region. The implications are clear. Climate change is rewriting the rules. Our research calls for urgent action. Governments should enhance surveillance in these newly affected areas, integrating climate and ecological data. They should develop climate-driven early warning systems to predict outbreaks. They should also create dynamic risk maps for these highland areas, while also providing vaccine stockpiles and diagnostics, while training healthcare workers on detection and response towards RVF. Lastly, they should empower communities with public health education and climate adaptation strategies. By addressing RVF through targeted research, policy, and community action, we can safeguard both human and animal health against the challenges of a changing climate.
Support innovation for a healthier planet.